Believe it or not, you swallow mucus and probably a lot of it. That's right. I mean, generally, we actually swallow mucus on a normal basis unconsciously. It's like something we just do. The glands in our nose and our throat are continually producing mucus, normally 1 to 2 quarts per day, believe it or not. But for good reason. Mucus does a lot of good things. It moistens and cleans our nasal lining. It moisturizes the air that we breathe. It traps things that shouldn't be there. It prevents infections, so many things. But when we get a feeling of the mucus sort of gathering in our throat or dripping from the back of our nose, that's when we start thinking about postnasal drip. By the way, this is according to the American Academy of Otolaryngology, Head and Neck Surgery. So, all right, we're talking about postnasal drip today, guys. I'm Dr. Jen Caudle. It is good to see you. I'm going to tell you the symptoms of postnasal drip, what causes it, and then how to treat it. So symptoms, what do we got here? First of all, is the feeling of mucus in the back of your throat. Probably a hallmark symptom. You feel the drainage, but you may not have that. You might just have a cough, or you might be swallowing a lot, or clearing your throat, or feeling like you have hoarseness or like raspy speech. And then a lot of my patients often feel like they have a sore or irritated throat. And then some people actually feel like they have a lump in the back of their throat as well. It's funny, even though we're talking about mucus that sort of drains to the back of the throat, it's amazing all the types of symptoms or ways that it can manifest, right? You can just have a cough or just have a scratchy throat or things like that. And that can be postnasal drip. Now, causes. Let's go to that. So what causes it? Lots of things. Things like colds and flus, viruses, bacteria, the flu, sinus infections, but also things like cold weather. Like when I go out into cold weather, my nose runs, and I get postnasal drip. Change in weather, dryness in the air, even bright lights can do it. Wild. Spicy foods, pregnancy, even medications. And as we get older, we may be more likely to have postnasal drip. And then a big one, by the way, is acid reflux, chronic acid reflux, gastroesophageal reflux disease. This is and can be a big one. So the big question here, I know you're wondering, is, all right, what do I do about my postnasal drip? Maybe you have that sort of scratchy feeling in the back of your throat. You may feel like there's a lump in the back of your throat. You may feel like a little bit of like a cough, or like there's something dripping back there. The main way that we treat postnasal drip is we got to get to the root of the cause, right? We've got to deal with what's causing it. Think about all the things I just mentioned that could potentially be causing postnasal drip. So let's start with like seasonal allergies. For me, that's a big cause of my postnasal drip. What do I have to do in order to get rid of the postnasal drip? I generally have to treat my underlying seasonal allergies. That's with the nasal sprays and prevention and things like that. Or if the issue is that you have an underlying infection, bacterial, viral infection, it's managing that infection. There's other conditions as well. Gastroesophageal reflux disease, okay? Minimizing acid reflux. I'm going to link videos to this video, like on like ways to deal with allergies, ways to deal with GERD, things like that, prevention. But you see how postnasal drip is often a part of a larger sort of picture here. We have to deal with the underlying cause. Now, there are some underlying causes that we may not be able to deal with. Maybe there are certain medications that you're not able to get off of that may be contributing to this, or you're pregnant. For many causes of postnasal drip, we can deal with that underlying cause and help reduce the symptoms of postnasal drip, which is ideally what we want to do. But what I would say is if you still struggle with postnasal drip, you're not able to get relief, you're still struggling despite different treatments, etc., you need to see a specialist. First of all, you should be seeing your doctor anyway about this, just to make sure you get a proper exam. Your doctor's looking in your ears and your nose and your throat, etc., putting everything together, making sure that it's that and not something else, but also giving you proper treatment. And remember, there are ENT specialists, etc., that I often refer my patients to, and your doctor very well does as well, to help with situations that may require their care. Okay, so just keep this in mind. Postnasal drip, super, super common, but in many situations, we can do something about it. Let me know in the comments if you struggle with postnasal drip or anything like this. Please share this video with other people. My name is Dr. Jen Caudle. On Facebook, please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I do daily videos, so please follow me I'm on Instagram and TikTok and WhatsApp, etc. at Dr. Jen Caudle. And then go to my website, www.drjencaudle.com. You can sign up for my free health newsletter. Guys, I'm Dr. Jen. I'll see you soon.